Renal case study. We have a 52-year-old male who has a history of hypertension, diabetes mellitus type 2, chronic kidney disease, and congestive heart failure. He presented to the ED reporting severe itching, nausea, and vomiting. He appeared pale and is lethargic, reported shortness of breath, and the nurse notes crackles in his lungs. He has now been admitted to the hospital. Upon further questioning, the client reports he normally gets dialysis Monday, Wednesday, and Friday, but he skipped dialysis yesterday because he wasn't feeling well. He has 2+ pitting edema in both legs. His vital signs: heart rate is 102, respiratory rate is 24, blood pressure is 153/97, and his SaO2 is like 92%. Well, he has a history of CKD, chronic kidney disease. He's got severe itching. He's got nausea, vomiting, shortness of air, crackles in the lungs. He skipped dialysis, and he has an elevated heart rate, and elevated respirations, elevated blood pressure. Don't forget that he was also pale and lethargic, and a low oxygen saturation. Well, implications of his CKD is he's got fluid volume overload, in addition to a buildup of toxins, because our kidneys get rid of a lot of waste. And if they're not working appropriately, that waste builds up and becomes toxic. The itching could be caused of CKD or liver failure, atopic dermatitis, different medications, potential illnesses or infections. Nausea and vomiting might be caused by illness or infection, medications, pregnancy, and vertigo. I do understand that this gentleman is probably not pregnant, but it is a very common cause. Shortness of air might be caused by respiratory illness or infection, being overweight, congestive heart failure, hypoxia, fluid volume overload. Those crackles, fluid volume overload, respiratory illness and infection. He skipped dialysis. What are those implications? Well, he does have increased fluid volume and toxins. The heart rate, fluid imbalance, respiratory or cardiac illnesses, other illness or an infection. The elevated respirations might be from a fluid imbalance or maybe cardiac or respiratory illness, potentially respiratory infections or hypoxia. Might be elevated blood pressure, or the elevated blood pressure potentially caused by being overweight. That high fat, high sodium diet, different medications, cardiac disease. And then the low oxygen saturation, respiratory illness or infection, being overweight, congestive heart failure, hypoxia, and fluid volume overload, or potentially cardiac disease. What do we do? Well, let's start off by educating the client on the importance of his diet and treatment regimen. We may need to give some uh, cool soaks or decrease the temperature for the itching, administer antihistamines or antipyretic medications. Excuse me. Educate the client on the importance of not scratching. Apply moisturizers to the skin or increase the fluid intake. For nausea vomiting, we may need to give fluids, the oral or intravenous, the antiemetics, or monitor the vital signs and the mental status. Being short of air, we might need oxygen or increase rest periods, elevate the head, do some bronchodilators. For the crackles, let's put some oxygen on, encourage that rest, elevate the head, bronchodilators, but we might also need some diuretics or antibiotics if it's an infection. Because he skipped dialysis, we have to educate on the importance of not missing dialysis. They will not live very long if they're not able to get rid of that fluid and those toxins. The elevated heart rate, make sure they're getting plenty of fluids, but at the same time, maybe they have too much and we have to take some fluids off. And medications. Don't forget to do diagnostics for potential other causes, such as anemia, cardiac, or respiratory issues. For the elevated respirations, let's do those deep breathing exercises and pursed lipped breathing, oxygen or elevate the head, the bronchodilators. For the elevated blood pressure, we need the antihypertensives. Maybe encourage some weight loss, that low fat, low sodium diet, or diuretics and exercise. Low oxygen saturation, well, let's put oxygen on, elevate the head of the bed, and do diagnostics for other potential causes.